Cancer prevention. What you need to know. Cancer remains one of our greatest health challenges, affecting millions worldwide each year. But here's the hopeful news. Experts estimate that between 30 to 50% of all cancer cases are potentially preventable. Today, we'll explore the factors that influence cancer risk and the evidence-based strategies that can help reduce your chances of developing this disease. We'll cover biological, environmental, lifestyle, and even psychological factors, giving you a comprehensive understanding of cancer prevention. So let's begin by understanding what cancer actually is and how it develops. Part 1. Cancer Basics. At its core, cancer is a disease of DNA damage. Our cells constantly grow, divide, and die in a controlled manner. But when DNA becomes damaged, some cells may begin dividing uncontrollably, eventually forming tumors. This process typically happens in stages over many years. First, there's initiation, when DNA damage occurs. Next comes promotion, where additional factors encourage abnormal cell growth. Finally, there's progression, as cancerous cells develop the ability to invade nearby tissues and spread. Understanding this multi-stage process helps explain why cancer prevention can be effective at different points in our lives. It's never too early or too late to take steps to reduce your risk. Now, let's look at the risk factors we can't change, and those we can. Part 2. Non-modifiable risk factors. Some cancer risk factors are beyond our control. Age. Cancer risk increases as we get older, with about 60% of cases diagnosed in people over 65. Genetics. About 5–10% of cancers are directly linked to inherited genetic mutations, like the BRCA mutations associated with breast and ovarian cancers. Family history. Even without identified mutations, having close relatives with certain cancers can increase your risk. Biological sex and ethnicity. These factors influence cancer risk through hormonal, immunological, and other biological differences. While we can't change these factors, knowing about them allows for appropriate screening and early detection, which can save lives. Part 3. Modifiable risk factors. Now for the empowering part, the risk factors we can change. Tobacco use. Tobacco remains the single largest preventable cause of cancer worldwide, responsible for about 22% of cancer deaths. It contributes not only to lung cancer but also to cancers of the head and neck, esophagus, bladder, and many others. The good news? Quitting at any age brings benefits. After 10–15 years, an ex-smoker's lung cancer risk drops to about 1/3 to 1/2 that of someone who continues smoking. Diet and weight. Unhealthy food choices. What we eat significantly affects our cancer risk. Diets high in processed meats and red meat are associated with increased risk of colorectal cancer, while diets rich in fruits, vegetables, and fiber appear protective. Excess body weight increases the risk of at least 13 types of cancer, including breast, colorectal, and pancreatic cancers. This happens because fatty tissue produces hormones and inflammatory substances that can promote cancer development. Regular physical activity reduces cancer risk through multiple mechanisms. It helps control weight, reduces inflammation, improves immune function, and helps regulate hormone levels. Just 150 minutes of moderate activity per week, that's 30 minutes, 5 days a week, can reduce overall cancer risk by 10–20%. Alcohol is classified as a carcinogen, increasing the risk of several cancers including breast, colorectal, and liver cancer. The relationship is dose-dependent. The more you drink, the higher your risk. Even light drinking increases risk somewhat, so limiting alcohol consumption is an important prevention strategy. Environmental exposures. UV radiation from the sun is the leading cause of skin cancer. Protecting your skin with sunscreen, clothing, and avoiding tanning beds significantly reduces risk. Other environmental factors include radon in homes, certain workplace chemicals, and air pollution. Being aware of these exposures and taking protective measures can substantially reduce risk. Part 4. Psychological factors. Emerging research suggests that psychological factors may also influence cancer risk. chronic stress can suppress immune function and potentially increase cancer susceptibility. The stress hormone cortisol, when chronically elevated, may impair the body's natural defenses against abnormal cell growth. Emotional well-being matters too. Studies have found associations between persistent negative emotional states like depression and increased inflammation in the body. This chronic inflammation may create conditions favorable for cancer development. Conversely, social connection appears protective. Strong relationships and support networks have been linked to better immune function and potentially reduced cancer risk. While the exact mechanisms are still being studied, practices that reduce stress and improve emotional well-being like mindfulness meditation, regular exercise, and maintaining meaningful relationships may be considered part of a comprehensive prevention strategy. Part 5. Prevention Strategies. So how do we put all this knowledge into practice? Here's a comprehensive approach to cancer prevention. Primary prevention means preventing cancer before it starts. Avoid tobacco completely. Limit alcohol consumption. Maintain a healthy weight. Stay physically active. Eat a plant-rich diet. Protect your skin from UV radiation. Get vaccinated against HPV and hepatitis B. Reduce exposure to environmental carcinogens. Manage stress and cultivate social connections. Secondary prevention involves detecting cancer early when treatment is most effective. Follow recommended screening guidelines for breast, colorectal, cervical, and other cancers. Know your family history and discuss appropriate screening with your healthcare provider. Pay attention to unusual changes in your body and report them promptly. Remember, these preventive measures don't just reduce cancer risk, they improve overall health, quality of life, and longevity. Cancer prevention isn't about eliminating risk entirely, that's simply not possible. Rather, it's about creating a pattern of living that minimizes preventable risks while maximizing protective factors. Each small step you take matters. By making these evidence-based practices part of your life, you can significantly reduce your cancer risk and improve your overall health. Thank you for watching.